Hello all, this is Ramesh, Assistant Professor in the Department of Psychology. Last class we seen about what is assessment process. Today we are going to see about the role of assessor in assessment process. Psychological assessment is a planned professional procedure. It is not just a use of one test. It involves several connecting activities such as gathering information, measuring psychological traits, interpretation of the results, and communication findings. The main aim of the assessment is to transform the raw, the raw psychological data into a meaningful conclusions that can help in understanding an individual deeply. Every stage of the assessment is guided by a scientific principles and ethics should be followed, standardized, and assuring the accuracy and fairness in the assessment. Assessment function as a continuous decision-making process. Psychologists make professional judgment at every stage of the test, before the test, during data collection, and after the interpretation of the results. Each decision influences the final conclusions of the test. For an example, choosing inappropriate test or misinterpreted scores can reduce the accuracy of the findings. Therefore, um, careful and informed decision making is essential throughout the assessment and its process. The role of an assessor in the assessment. The assessor plays a central role in psychological assessment. They are responsible for integrating the information from multiple sources such as interviews, observation, nonverbal cues, identifying nonverbal cues. Proper training is essential for a psychologist for to conduct a psychological assessment. Ethics and interpretations are essentials. The assessor must remain objective and avoid personal bias during the test. Since assessment results may affect an individual's educations, career, treatment plans, and the assessor is ethically responsible for the outcomes during the assessments. The assessment process is begin when a problem is identified or the concern is identified. Referral may comes from schools, hospitals, court, or an organizations. This stage clearly defines why assessment is required. The referral set the limit of the evaluation and prevents unnecessary testing for the subjects. Defining the general assessment objectives. General concerns are converted into specific assessment questions. Assessment questions help us to identify the psychological area need to be examined, such as intelligence, personality, emotional intelligence, emotional functioning. Clear objective prevent excessive testing and makes the assessment more effective and focus on the topic that we need to assess. Collection of personal data or contextual informations. Initial data includes personal details such as age, education, occupation, social backgrounds. Understanding the individual's environment and cultural background is important for accurate for the interpretations. This steps ensures the assessment is person-centered rather than purely score-based. Reviews of past records. Past records such as academic report, medical histories, clinical notes are carefully interviewed during the assessment. These records help us to identify a pattern over time of an individual and differentiate between temporary difficulties and long-term or long-standard problems. Reviewing past data strengthen the reliability of the assessment and help us to overcome from a conclusion for the assessment. Selection of assessment method. There are different type of assessment methods out there. Selecting the assessment technique based on the purpose of the evaluation and the characteristics of the individuals. Methods may be include psychological test, structured interviews, behavioral observation, and rating skills. All tools must be standardized, reliable, and culturally suitable for the individual. Ethical practice demands sensitivity to languages and cultural backgrounds. The different peoples comes from different cultural backgrounds, so we need to ensure it should be suitable for the individual. Preparation of the assessment. The test environment should be quiet, comfortable, and free from distractions. Clear instructions helps to reduce anxiety during the test and confusions during the test. Standardized administration ensure fairness. The examiner's attitude or behavior can influence the client's performance, behavior, and attitude towards the test. So professionalism is essential for conducting an assessment. That's all for today's class. In this class, we get to know about the role of an assessor during an assessment, what are the ethics that he or she needs to follow during an assessment, and what kind of an environment that the assessor to create for their clients for to get to know about the clients effectively. Thank you.